So, to conclude, I've shown you here today that ADHD is a disorder not just of attention, but of self-regulation. And that as a result of that, and of their reduced time horizon, their time blindness or nearsightedness to the future, people with ADHD are making hundreds of poor decisions each day when it comes to maintaining their health and wellness, opting for immediate, short-term, small rewards and gratification instead of pursuing larger, longer-term improvements in their welfare. And this applies specifically to decisions they make each day about health, diet, exercise, and wellness. This helps us to understand why ADHD is associated with numerous and serious impairments in all major life activities, from family functioning to peer relationships to educational risks, as well as to problems with driving, drug use, risky sexual activity, problems with occupational functioning in adulthood, with interacting with others, particularly in intimate relationships, with raising children, and so on, and managing our money. All of these domains of life and others are affected adversely if someone has ADHD that goes untreated. And now, in this presentation, I've shown you that it isn't just these other domains of education and work and social functioning, but that ADHD has an adverse effect on health, wellness, and lifestyle risks, resulting in a negative impact on early mortality and long-term life expectancy. As many studies have shown that I explained here, ADHD increases the risk of early death in children, and markedly more so in adults as a result of accidental injuries, to a lesser extent suicide, and even to a smaller extent homicide. But my studies show that it is also reducing one's life expectancy and increasing risks later in life as a result of poor health maintenance practices and engaging in much greater adverse activities when it comes to our health, thereby increasing the likelihood of current and future medical problems, which taken together can reduce life expectancy by as much as 10 to 13 years. We have found that this isn't just hypothetical, that if we study the decision making of children and adults, especially adults with ADHD, each day we find that they are, in fact, opting for very impulsive choices and short-term gratification over long-term health and welfare. So my speculation at the beginning of this presentation that ADHD is predisposing to such poor daily life choices has in fact now been proven to be the case, and provides the link between having ADHD and experiencing all of the health and medical risk factors I have discussed in this presentation. What are the implications of this for families and for managing ADHD? This means, as I've said, we need to look at ADHD as a serious public health problem, far more serious in its impact on estimated life expectancy, what I call ELE on this slide, than any other single risk factor about which our healthcare agencies and medical professionals and governments are currently concerned about. It's far worse than just smoking or use of alcohol or obesity or nutrition. And that's because ADHD is predisposing people to engage in almost all of these other health risks. And therefore, ADHD has a far greater effect on one's lifespan than any of these individual factors by themselves, or even some of them in combination. So we all need to take ADHD a lot more seriously as a public health disorder than we have currently. As I've said, ADHD is 2 to 3 times worse than even the big four risk factors that our health agencies and medical care professionals are currently concerned about. And if you look at the dollar costs of ADHD, its economic impact, we see that ADHD results in, on average, about $26,000 US dollars in excess expenses per individual per year of life in increased costs to our health care, social care, and our criminal justice, juvenile justice agencies in the U.S. This has also been found to be the case in Australia, in Scandinavia, and elsewhere in Europe. So it's not just a U.S. issue. ADHD is a very, very expensive disorder when it comes to health care, government assistance, and other areas of social support. We need to take ADHD seriously and especially treat the underlying behavioral inhibition problems, that low conscientiousness, that poor choice making in life. And the best way to do that currently is with a combination of therapies, both medical and psychosocial. But especially evidence shows that it's the medication interventions for ADHD that are much more likely to improve these domains of functioning and to lower life course risks during times that people are treated compared to times that they may not be. Indeed, entire population studies in Brazil, Scandinavia, now the United States, and elsewhere have shown that when people with ADHD take their medications, there is a reduction back to near normal levels in their risk for accidental injury, for driving accidents, for suicide, as well as for risky sex, adolescent pregnancies, the risk of obesity, of antisocial behavior and crime, and possibly the risk of engaging in substance use and abuse. Indeed, most recent studies show that being on medication also lowers that risk of mortality in children and in adults. So treating ADHD across the lifespan, as long as it remains a significant and impairing disorder, will have a positive effect on mortality and on life expectancy. So we know what to do. The problem is we're not doing it. So what does this mean? For patients and families with ADHD, you need to be more aware of these health risks and engage in risk reduction practices. Right now, people think of ADHD as a psychiatric disorder, maybe even as an educational problem because of the high risk of impairment in school settings. But rarely do people look at ADHD through a much broader lens, that it could be a public health problem as well. And so families need to take this risk seriously and spend more time not just trying to improve school or peer relationships and so on, but also trying to improve health and wellness. The same advice applies to mental health professionals who also look at ADHD through a very narrow lens or focus, seeing it primarily as a psychiatric disorder. They also need to broaden their evaluations, looking at various aspects of health, lifestyle, wellness, exercise, and then help their patients to engage in self-improvement practices to reduce those risk factors. But as I've said, that's not going to be of much help if we also aren't managing their ADHD specifically, because all health improvement activities require self-regulation. And if ADHD is ruining self-regulation, then it's also going to ruin or worsen the likelihood that someone will be successful at self-change, including in their health and wellness. Now, we also need to work with primary care providers, not just mental health professionals, not just families, but people who are primary care medical providers, such as internal medicine physicians, family practitioners, pediatricians, and others in general practice, to make them aware of these risks. Do you know that primary care professionals typically receive absolutely no training in the identification and management of ADHD in their medical school careers? Indeed, no specialty in primary care mentions ADHD at all in their practice guidelines for their professionals. They talk about anxiety, they assess for depression, they've become much more comfortable in identifying those mental health problems and even managing them within their practices. But there's no mention of ADHD. And yet ADHD, as I've shown today, is a far worse psychiatric and healthcare problem than are those other disorders. So we need to take steps to include knowledge of ADHD, diagnosis of ADHD, and management of ADHD in the curriculum of the medical education of these primary care providers so that they can begin to screen for, identify, and even manage ADHD. They're already seeing it, they're just not recognizing it. They see it because they are the ones who are most likely to see people who have health and wellness problems. They're the ones working with people who want to quit smoking, want to lose weight, want to reduce alcohol consumption, want to exercise more, and improve all the other risks we talked about. These are the medical professionals who see these people first. But when they see people who are overweight or smoke too much or drink too much alcohol and so on, they don't even think about asking about ADHD, even though ADHD is a highly probable disorder that underlies these other healthcare problems. And if they don't identify ADHD, then their patients are going to fail in trying to improve these various aspects of their health and wellness. Because as we've shown, ADHD is the underlying problem that is predisposing to all these other problems. It's a self-regulation problem. And if you don't treat it, if it's there, if you don't treat it, then these people are going to be much less likely to change these health and wellness aspects of their life. So we need to take seriously education of our primary care medical professionals to help us out here and begin to identify ADHD as they see people with various healthcare risks. Finally, we need to make governments more aware of and accountable for managing ADHD than we currently do. Our government officials, particularly in the area of healthcare and insurance and so on, medical regulations, for instance, are completely ignorant about the role that ADHD plays in all of the things they're concerned about with regard, excuse me, pardon me, with regard to improving the health and wellness of the population, which is what they are charged to help with, public health. And yet ADHD gets no mention across all of these agencies, policies, and interventions to improve the health and wellness of our population. So governments need to take ADHD more seriously, be more aware of it, and engage in interventions for ADHD if they really expect to improve the health and wellness of the population. Let's understand that despite all of these risks and negative findings that I've talked about here today, ADHD is one of the most treatable, if not the most treatable disorder in psychiatry. We have more treatments, particularly medications, that improve more people's symptoms and do so to a much greater extent across more areas of major life activities than is seen in anxiety, depression, relationship issues, and all the other things that we treat in outpatient clinics. ADHD is much more treatable than those disorders. And so there is a great deal of hope that we can not only improve ADHD in these individuals and reduce their risks in various major life activities, but also improve their health, their wellness, their lifestyle choices, and their life expectancy. The greatest problem we experience now in the US, but also elsewhere, is that treatments for ADHD are difficult to access. Indeed, most adults with ADHD are never diagnosed and treated for the disorder. And while more and more children with ADHD are being diagnosed and are receiving some treatment, there is little attention paid to this area of health, wellness, and medical problems. So it's access to care, it's identification of cases, it's educating medical and other healthcare providers about ADHD that's the problem and that needs to be addressed. It's not that we need more treatments. We need access to those treatments to be more readily available across all segments of our population if we expect to do anything about these risks. Doing so would result in marked reductions in the cost of health care, because right now we are paying for the risks that ADHD creates in obesity, smoking, accidental injuries, and so on. We already pay for those risks through our health care and other systems. And we could reduce those costs if we simply treated the ADHD, identified it and treated it, of course, than what we're doing now, which is turning a blind eye toward the existence of this disorder and then trying to reduce these other healthcare risks directly. So treating ADHD has been shown to result in 7 to 10 times less expenditures in healthcare, in treatment, and so on for people with ADHD if we simply treat the disorder appropriately. So I hope that this presentation has shown you that ADHD is a serious disorder. It's a public health disorder, and it's highly treatable. We just need to take the time to identify it and treat it appropriately, and then we should see marked improvements across all the domains of life that I've spoken about today in these individuals with ADHD. I hope you will join me in doing so. Thank you so much.